Hey, it's Erin, the ER educator, and today we are going to look at ER documentation. So when we think about documentation, we're going to first start this lecture by looking at three different case studies. Then we're going to talk about the importance of medical documentation. We're going to look at the applications and uses of medical documentation. We're going to look at what good documentation practices look at some documentation errors, and then understand the legal implications of documentation errors. And then kind of just go through a list of do's and don'ts. As I'm sure you have all heard many times before, if it's not documented, it didn't happen. Regardless if it happened or not, if it's not documented, it didn't happen. So let's start off and look at some case studies. So I'm going to give you time. Go ahead and pause the presentation. Go ahead and look at these case studies and fill out your corresponding worksheet. But as you're going through the case studies, kind of just look at these and see where documentation could have been better, where things went wrong, and then kind of just do a little bit of reflection as to like how not having proper documentation really hindered these cases. So go ahead, pause it, and then go through and take a peek at these and then fill out your worksheet. So again, as you've looked at these case studies, you can see that all of this documentation, or lack of documentation in this case, if it wasn't documented, it didn't happen. And unfortunately for these patients, some of them, life-altering, one patient died, and then the other two actually won significant lawsuits because there wasn't proper documentation. So not meaning to scare anybody, but just kind of keep these things in mind as we go through these next few slides and we look at good versus bad documentation. So, why is it important that we document? Well, documentation is essential. It's part of our healthcare. I mean, everybody knows that we spend a bajillion hours charting things, right? But really, it ensures and continues quality patient care. It also carries a significant legal implication, and we'll talk about that. From the patient perspective, it helps us maintain comprehensive records to help healthcare providers make informed decisions about the care of patients. We typically follow medical and regulatory boards along with facility policies when in terms of figuring out how often we have to document, what we need to document. So we follow those kind of policies to kind of help guide us with that information. But for the most part, we want to make sure that we're documenting really good patient assessments, interventions, the response to interventions, and then if things did or didn't work, and if they didn't work and the patient's not feeling better, we also need to document that we have escalated our concerns. Or if there's been a change in status, we need to document that we've escalated our concerns. So it's really important that we follow the policies and that we adhere to the principles of integrity, honesty, and accountability when documenting patient care activities. Again, when we document interventions and observations, we also need to document the patient response. And then we need to be mindful of, like I said, if the patient's getting better, great, we document that, like whether that be a pain scale or we give a neb maybe and the patient's lung sounds improve. We need to document that the patient's lung sounds have improved. And again, if there's a change in status, we need to document that we've escalated our concerns and then the response to that. We want to make sure that we're documenting interventions and then patient responses so we can identify early warning signs and take proactive measures to prevent adverse outcomes. We don't necessarily want to be reactive. And as we all know, documentation is a means of communication between healthcare team members. It kind of provides an overview of the patient's condition, again, their progress, treatment plan, so that all members of the team can collaborate effectively for the betterment of the patient. So it's a really good idea. Just kind of think about when you're documenting, what do I need to put into this chart so that the next person coming on after me has a clear idea of the care that was provided to this patient and their response to the treatment. It's important that if I always think about it, one of my preceptors told me that if I am not able to give report for whatever reason, and then the oncoming nurse behind me had to figure out what happened with this patient, they should be able to read through your documentation and figure out what happened, what's been going on, what needs to be done, etc. So just think about it from that perspective too. You want to be able to tell the patient's story. And we know that inadequate charting and documentation can lead to medical errors, miscommunication, misunderstandings, patient safety concerns, and lower quality of care. And I think you could have seen that just looking at the 3 case studies. From a legal perspective, documentation also serves as a legal defense for healthcare providers in the event of lawsuits or malpractice allegations. So it is important that we have comprehensive documentation to provide evidence that the care provided was consistent with protocols and policies. And again, it can be a crucial defense against allegations of medical malpractice. We also know that good documentation helps us with chain of custody and medication errors. Again, as you've seen in some of the case studies. So you can see here how really important it is to have proper documentation. So what does good documentation look like? Well, we want to make sure that we have the right patient, right? Name, date of birth, gender, ethnicity, contact information, race, marital status, insurance information. Now, is that the ER nurse's job or the tech's job? Probably not, right? But we need to ensure when we're providing care that we at least are identifying the patient using 2 identifiers. We want to make sure that we have an accurate medical history. Medical, surgical, their social and lifestyle, like could they be pregnant? Are they using drugs and alcohol? Those are important. What allergies they have, what medications they're taking, hospitalizations, etc. And then always, especially in the ER, what's their chief complaint? What is bringing them in today? How is that different than their everyday complaints? What is different today? What brings them in? And then relevant history. Any recent diagnoses. You don't need to know that they stubbed their toe 20 years ago, but hey, if your patient is having chest pain and they just had a stent placed last week, that's important to know, right? So any recent diagnoses, any recent labs or treatments, especially if they're outside of Health Partners and we don't have access to their medical records, that's important. And then accurate assessments. Getting that set of vital signs, getting in your initial physical assessment so you can base all your other assessments and interventions and observations off of that base, right? How can you tell if somebody's getting better or worse if you don't have that base physical assessment at the start of your shift? Mental health assessment, that is required per our policy. And sometimes a negative assessment finding is just as important as a positive assessment finding, and that should be documented as well. So what does that mean? Well, a negative assessment finding is that there's nothing wrong, right? So I think of like an anaphylaxis patient. I personally always chart airway, breathing, circulation, and a neuro status on every single patient that I have. And so if you have an anaphylaxis patient and you go in and you're assessing them and their airway is clear and they're having no signs of swelling in their throat, that's considered a negative assessment, and that is just as important as a positive finding. So just keep that in mind, that sometimes a within normal limits or a negative assessment is as important, if not more important sometimes. We also want to document if there's been any changes in patient status, and that can be a rounding note, that can be a chart note, that can be in your vital signs, that can be in your assessments. However you want to document that, great, do that, but make sure that if you find something wrong with the patient and there has been a change, that you escalate your concerns. As a nurse or a tech, it's not super important that we get an accurate diagnosis. However, our assessments, our interview of the patient, our findings help the doctors make an accurate diagnosis. So it's all part of their care. We also need to make sure that we're documenting clear treatment and management, and again, how they respond. And then anytime that there is a consent that needs to be obtained, again, that's the physician's job to get the consent, but as nursing staff, we need to verify that the consent was taken, unless it's an emergent thing, but for the most part, we do informed consent. And then any future treatment recommendations. And then again, as we've talked about already, have we done treatment? Has there been medication with clearly documented patient education? Are you getting ready to discharge your patient and you are documenting that you've provided discharge education? That's important. And sometimes when I've had patients that you need to provide a teach back and have them teach it back to you so you ensure that they understand, I'll put that in my discharge note. Or, if the patient's a pediatric patient, obviously you're not going to teach them about antibiotics, you're going to teach the parents. So I write in there, no, I have not educated the patient, I've educated the parents. So make sure that you're doing that. And then recommendations for returning to the ER, right? And this is in our discharge information. Worsening or new symptoms, changes in status, etc. And patients need to verbalize that they understand that, and then we document that. So that's what good documentation looks like. And again, this is not an all-inclusive list by any means. This is just, things that we absolutely need to hit. So now that we've kind of looked at what good documentation is, let's look at common documentation errors. So things that kind of get us in trouble is when we have no date, time, or signature. And luckily for us, when we're in Epic, those things automatically get entered in when we put a new entry in. But if it doesn't for whatever reason, you should always be including those things. Typos are a problem and a documentation error, especially when it changes the meaning of a word. So if you think about like the patient was hypoglycemic when they should have been hyperglycemic, that can be a problem. Transcription errors, as nursing staff and techs, we don't see that a lot, but the docs certainly could, especially if they're using the voice prompt. I've definitely seen transcription errors. And it just doesn't look good, right? Like if that goes off to court, that's just not a good look. It's going to make it look like you don't value the things that you're writing. And if you don't care about that, do you not care about other things? It just doesn't look good. It questions the validity of the rest of your documentation. Other documentations could be when we omit words, assessments, or interactions. So even if it happened, again, if it wasn't documented, it didn't happen. So make sure that every interaction you have with the patient, whether it just be a rounding thing, document it. Get credit for all the work that you're doing, because you get up and answer call lights, you interact with patients, you bring them water, whatever. Make sure you're documenting that. That's all your time, right? If the patient says, well, gosh, I haven't seen my nurse or the tech in 3 hours, well, no, that's not accurate. They've taken you to the bathroom, they've brought you your Sprite with ice, they've ambulated you down the hall. Make sure you're documenting all those things. It just helps show a timeline too of our interactions. One of the biggest things we can get in trouble with is if we fail to document new or worsening symptoms, changes in vital signs, or a change in status, especially if the concerns need to be escalated. So again, like, hey, I went in, I rounded on my patient, the patient was more somnolent, or we noticed that they've, had 3 blood pressures that are hypotensive, notify the doctor at this time. Again, that's not that you're pushing off all the responsibility, but you've recognized the change in status and you've escalated to the nurse or you've escalated to the physician. Incorrect instructions, so discharge teaching, medication teaching, medical device teaching. Again, you want to make sure that you're educating the patient and that you're documenting that you educated the patient. And if they still don't get it, you need to have them teach that back to you, and then you need to document that you've done a teach back. Not documenting conversations about risks and benefits is a no-no. So let's say our patient wants to leave AMA. That's totally fine. Let me get you the AMA paperwork, but you need to document and have the conversation that you have explained all of the risks and benefits about leaving versus us wanting you to stay. Explain why you want the patient to stay. And if they still want to leave, you need to have that conversation with the patient saying, hey, we're concerned about you. We want you to stay. If you don't, you need to sign this form. And then you need to document that you have explained the risks and benefits and that the patient still wants to leave against medical advice and that the form has been signed. That is super important. Another error is using abbreviations. So some abbreviations are fine, right? They're common knowledge, but don't just throw random abbreviations in there, especially that, there could be multiple abbreviations for multiple words, so we don't want to do that. Charting on the wrong patient, we've all done that, right? And then vague, subjective, or judgmental language. So that can be a problem. If you want to document anything that the patient says, put in there patient stated or put it in quotations, especially if you're trying to convey how a patient is acting or what they're saying. Make sure to put it in quotes. But we don't want to do anything judgmental, like the patient appeared lazy and they didn't want to take their medication. Well, what does appearing lazy look like? That's pretty subjective. So use your objective findings, but then document if they're appearing a certain way. Use your mental health assessment to help you figure out how they're acting, or, again, put it in quotes, or nurse observed such and such. And then certainly, again, a wrong diagnosis. So this wouldn't necessarily be on the tech or the nurse, but again, all of our assessments and documentation helps make the correct diagnosis. So we want to be a part of the good, not the bad. So consequences of poor documentation. So we've touched on this a little bit, but it leads to poor communication, medication errors, inappropriate or unnecessary testing, missed or delayed diagnosis, failure to follow up on abnormal assessments, vital signs, lab or radiological findings. It can lead to insurance coverage issues for the patient, whether it's intended or not. It can lead to reimbursement problems for the hospital or the patient. And then again, like we've talked about already, it certainly can lead to negligence or malpractice. So it's really important that we're all doing a good job, that we are documenting appropriately, and then again, conveying or escalating concerns when necessary. So just to kind of wrap up the do's and the don'ts. So when we look at the do's, make sure that we are following all state, regulatory, and organizational policies. Make sure we're using the correct patient. Everything should be accurate and precise. Only use accepted abbreviations. We want to make sure that we're documenting both those positive and relative negative findings on assessment. Make sure that you're using the patient's own words, gestures, and nonverbal cues as much as possible, which kind of again helps paint a picture of what you encountered. Use quotation or observed statements or patient stated statements. Record all care and the response to care, even if it seems routine. It's important that we're getting credit for the work that we're doing. Document in real time or as soon as possible. If you can't do that, make sure that your entries are timed in relation to the patient care. So say you have a code, that's why it's really important that you've got a good person doing your documentation and your record keeping so that you can go back in and time everything out in the chart appropriately. Make sure that you're noting any changes to the patient status. Also note who was notified. Make sure you pay attention to alerts. Always scan when necessary, especially with medication. We don't want a med error. Document all your communication with the patient, their family, in terms of plan of care, treatment, response to treatment, education, and discharge instructions. And it's always a really good idea, especially the notes, you guys, to review the entries before submitting and looking for errors and accuracy. Remember, your patients can see your notes. They cannot necessarily see the rounding notes unless they subpoena or ask for their full medical records. So keep that in mind, that if you just write in a blank note, your patients will see that in their MyChart. So to be mindful of that. In terms of don'ts, don't be judgmental or subjective. Just state the facts. Don't chart new or worsening symptoms without charting how it was treated and the patient's response. Don't include shorthand or abbreviations. Don't chart what someone else said, heard, or felt, or experienced unless the information is critical. And again, use quotations. Don't skip steps and try and avoid late entries. It's too easy to forget the details if there's a delay between the time you acted and when it was recorded. All right, you guys, if you have any questions, make sure to check out the policies and documentation for the hospital or the regulatory board, or certainly ask questions if you need it.